when are my follow-up appointments, and who will they be with? Typically for RLE, ICL, and any of these refractive surgeries, I'll give you a call, especially in my own practice. We tend to handle everything ourselves, Dr. Ebel and I. We will, you know, do your post-op either the day of surgery, right after surgery, take a look at your eyes, make sure everything's centered well, that the eye looks good, and that your vision is appropriate for, how dilated you are right after surgery. We expect, you can expect us to call you the day after if you, live far away or don't feel it's necessary to come in day one after surgery. So we'd call you and just make sure that the vision's improved overnight. Typically it does, takes a big step forward. And if it does, and you don't have any symptoms and you feel great, we just, we'll see you back in, a week or to a month or so. We can accommodate to your schedule. Obviously, RLE patients are in their, peak working years, and so they're busy lifestyles, and so we don't want to bother you with cookie cutter follow-up schedules that are more to do with reimbursement on the insurance side than anything medically related. That doesn't mean we don't want to see you anymore. We absolutely do. We do need to provide follow-ups to check your pressure, to make sure your vision is going the way we expect it to. But what I'm saying is this can be done at a convenient time for you. When you have direct access to the surgeon, to the doctors in the practice, you can always call us if you feel like there's something abnormal, right? And then you call us just to double check. And let's say day one, you feel like something was off, or in the first week, you'd call us and we'd say, hey, I think it would be good for you to come in today. I'd really want to double check that and make sure things are going well, and we're not missing anything here. It doesn't happen very often, but just know that you can do that, and we'd be more than happy to see you, in our clinic and just double check. For other practices that I work at, it's going to be different. I'm not usually there in those cities, so there are going to be other doctors there that can see you. But the same rule applies. If you feel like things are, you have a question about anything and doesn't something unexpected, just give the practice a call. They can fit you into the schedule. Usually there are more doctors in those other practices, you can drop in and at any point usually and be seen and be reassured that things are going okay. But essentially, in RLE practices and in refractive surgery, we can be at the, do things at the convenience of our clients, our patients, rather than the, cookie cutter follow-ups that are mandated by insurance. So if things are going well and you're seeing quite well day after surgery, you're impressed by your vision, we can just keep in touch regularly over the phone, or you keep in touch with Dr. Ebel over the phone, or text message, and then we'll see you back maybe a month after surgery to do a thorough check of your eyes. And then after that, as needed. You will need to see us at some point later after surgery, because there's a phenomenon called posterior capsular opacification after RLE and cataract surgery, which means that inevitably, whether it's a month or a year or 10 years after surgery, you're going to get this opacity or your own cells growing over behind the lens, not directly on the lens, but covering the posterior capsule or your own body's tissue. And then we would at that later point take a laser and in like 10 seconds, 20 seconds, remove all of that scar tissue. And you only have to do that one time after surgery, but it's inevitable that you have to do that at some point with us. So just and the symptoms are going to be, generally blurry or hazy vision with more glare symptoms. And if you feel like that's true, then come on in, have us take a look in the clinic, and we'll get that addressed for you if that's the case. Thanks.